Integrating Population, Health and Environment for Sustainable Development in Kenya, an Engage presentation. Kenya is a leader in Africa, especially when it comes to progressive policies and programs that improve the economic, social and political well-being of its people and strengthen its economy. Kenya also launched the National Climate Change Response Strategy to strengthen the country's resilience and capacity to adapt to a rapidly changing environment. And environmental champions like the late Professor Wangari Maathai have opened our eyes to the importance of environmental restoration. These policies improve health and set Kenya on the path toward economic growth and development. Still, more needs to be done to address the links between our rapidly growing population, our health and well-being, and how we use our natural resources. Kenya can be a leader in improved health, environmental sustainability, and greater economic prosperity by addressing all three challenges together. The Population, Health and Environment Approach, or PHE, recognizes the complex connection between people, their health, and the natural resources upon which they depend. PHE addresses population dynamics through voluntary family planning, which improves health outcomes for people and their children and the way people interact with their environment. PHE incorporates voluntary family planning information and services and primary health care with sustainable natural resource management. Imagine a family in rural Kenya. They're not always able to reach a clinic because it is often far away. But community health workers bring essential primary and reproductive health services to their home. As a result, the parents are able to plan and space the births of their children, and the entire family can access basic health services. The family depends on the environment for their everyday needs. Agriculture provides for their livelihoods and sustenance. The forest provides wood for fuel. Livestock graze on the grasslands. And the lakes provide fresh water for cooking and washing. Although the family relies on the environment, they are not overly dependent on these resources because they can generate income from alternative livelihoods, such as producing handicrafts. They have a fuel-efficient stove to heat and cook their food, and they employ sustainable farming, fishing, and grazing practices. Healthy and sustainable practices increase the family's resilience against growing environmental shocks that damage and deplete these natural resources. The family's resilience contributes to improved health, increased food security, and more income to invest in education and other household needs. These sustainable practices have an even greater impact at the community level. They are all connected and can be packaged as part of an integrated solution to sustainable development. In rural communities, where 3 in 4 Kenyans live, and most integrated PHE projects take place, health and livelihoods are inextricably linked with natural resources and food security. But rapid population growth, unsustainable use of resources, and climate change can have negative impacts on human health and may limit quality of life and economic growth. The environment affects the health and well-being of individuals and families, as does the area in which they live. Weak health and transportation infrastructure, especially in remote areas, prevent families from accessing health services. Access to health services is critical to continue to make progress in HIV and malaria treatment and prevention, water and sanitation, and maternal and child health. And reproductive health services, including family planning, impact not only the health and well-being of families, but also the rate at which our population is growing. For example, in Kenya's poor communities, women often have 2 more children than they intended to have. As a result, families need more resources to provide for everyone, which can increase poverty at the household and national levels. When families have more children than they want, the population also grows rapidly. In less than 30 years, Kenya's population more than doubled from 21 million in 1989 to 44 million in 2015, and is projected to reach 64 million people by 2030. This kind of rapid population growth can impact the environment and affect how people use their natural resources. The agriculture, forestry, and fishing sector employs 75% of Kenya's labour force. It contributed 1/3 of Kenya's GDP, or gross domestic product, in 2016 and is central to our development strategy. We must preserve these resources to meet our development goals. Yet today, farms are becoming smaller as farmers subdivide their land among their children. In fact, 2 in 3 rural farmers believe the land they own is not sufficient for their children to continue to farm. Forests are cut down at alarming rates to meet increased demands for farmlands, grazing lands, fuel, and housing. Lakes are experiencing declines in the volume of fish from unsustainable fishing practices and industrial use. In addition, changing weather patterns and extreme climate events such as droughts destroy crops and livestock, leading to food insecurity, loss of income for families, and increased poverty. Especially in Kenya's arid and semi-arid rangelands, which cover roughly 80% of the country and are critical to the livelihoods of pastoral and agro-pastoral communities. In fact, climate change is projected to have a negative impact on Kenya's economy, with losses across sectors estimated at about $1 billion to $3 billion, or 100 billion to 300 billion Kenya shillings per year by 2030. Women and girls are particularly vulnerable to climate change. Their household responsibilities, such as collecting firewood and water and farming, become a greater burden as they must walk further for wood and water and work harder to raise crops on depleted soils. In addition, there is an increased risk of human-wildlife conflict as communities migrate closer to more plentiful resources near protected areas where wildlife can damage their crops or homes. Diminishing resources and limited income-generating opportunities in rural areas can present challenges for young people who want and need to earn a livelihood, and pushes individuals and families to move to cities in search of work. The rapid increase of unplanned urban settlements poses a growing challenge to city officials as they attempt to meet the basic needs of the community. Integrated approaches to development, such as PHE, can effectively address population, health, livelihood, and natural resource challenges in a holistic way that meets specific community needs and yet addresses multiple connected challenges. PHE approaches improve the health and well-being of women, their partners, and their children by making health services more available. PHE approaches build the capacity of communities by sustainably using their environmental resources and taking up practices that may improve their resilience to climate change and adaptation. Let's take a closer look at how the PHE approach has improved the health and well-being of families, empowered communities, and helped preserve natural resources in Kenya. The Health of People and Environment Lake Victoria Basin Project, or HOPE LVB, began working in Kenya in 2012. HOPE LVB increased access to health services, including voluntary family planning. Through the project, more couples are delaying births and accessing critical health services, including maternal and child health services and HIV and malaria treatment and prevention services. Karen, a member of a women's community group, shares how the project has affected her family.
To nwakia kamane madhi kelo chandruok e udi kendo dhi miyo wabedo kod pek e udi makoro bende dichuo ok dwar ng'ato ok dwari. Mar ariyo, nyithindo ne nyalo tuoni ot kata ariyo kata adek nikech giluore ka moro tuo to moro tuo to moro tuo, koro gituo gi te nyithindo kata adek kokidwa chako thagri kodgi kiterogi e thieth kar gi ji adek. Nito ka luoro pongo tese gi jwelni, kit jwelni duto te opong'o dala to nok chandwa nikech ne pok wang'eyo. Koro nyaka gibi waseng'eyo ni nitie bugo mibole jwala yore.
As HOPE LVB increased knowledge of and access to basic health information and services, it also addressed the related environmental and natural resource management needs of the community. The project addressed livelihoods and nutrition, which are linked with the environment in fishing communities. Overfishing and unsustainable land use practices reduced the fish population and damaged the land that the community depended on. In response, the project increased community capacity for sustainable agricultural practices, which has reduced the reliance on any single natural resource and diversified sources of income and nutrition. Sarah, a woman from the HOPE LVB project area, explains.
Chono waketa ni kosero mundalo mipurega to pur mano kende gima watim. To sechegi kase keto bando ang'eno ni keto ganda, aketo rabuon kaka sani an gi rabuon moro na chako keto. Antiere galot mama no ne onge chon sani di kuro wachandore. Aneno kan gi chiemo sechete kata ji ni gi chiemo ni nekeche.
Learning skills for alternative livelihoods also diversified people's sources of incomes and decreased pressure on the environment.
Pidho yiende sani antiere gi yien manajo aonge godo chon kaka iloso jiko. Ang'eyo manyalo loso ne ng'ato, improved jiko. Mama no endo osemiya yuto already.
Hope LVB also helped the community in reducing wildlife-human conflicts.
There's a lot of wildlife-human conflict arising from people plowing up to the areas that are left for the wildlife. And this not only makes the shoreline shaky and therefore is easily eroded into the ecosystem. So the working closely with people from KWS and also working closely with our partner from agriculture, the communities were sensitized not to plow very close to the river banks, also not to plow very close to the shorelines, so that we reduce the conflict.
By reducing overfishing, food security has also increased because fish populations are now flourishing in Lake Victoria. A beach management unit which supports and enforces fishing laws established by the community has seen a marked difference in Lake Victoria.
Mane oketo demarcation mar breeding show man chieng' no ne an achiel kuomgi ne watimo demarcation kama rech nyuole.
Impressed by the positive impacts on health and the environment, Homa Bay County officials established a PHE department and steering committee to coordinate county PHE activities. Since health and natural resource management messages are packaged together and people's basic health, nutrition, and livelihoods needs are being met, communities embrace PHE approaches, making them sustainable beyond the life of the project. The PHE approach is also cost-effective, reducing the resources needed to implement health and natural resource management interventions by strategically integrating activities that complement one another and filling the gap left by single sector projects that only address some of the challenges communities face. From 2011 to 2013, the program Research for Strengthening Services, or Progress Project, in partnership with the Green Belt Movement, showed that environmental workers could effectively deliver health messages to their community members. The Green Belt Movement was established when women were having trouble meeting household needs for firewood. The organization educated women on sustainable tree planting practices. To address health needs in the community, the Progress Project also trained forestry specialists in Nyeri and Meru counties in effective health messaging that they successfully delivered to members of the community. The collaboration demonstrated that non-health community workers could effectively and enthusiastically deliver accurate health information to their communities. Green volunteers also increased male engagement and involvement in family planning discussions among male community members. These integrated approaches to population, health, and environment are taking place throughout Kenya and have the potential for implementation in other parts of the country. Together, these projects and other projects from around the world show that integrated PHE approaches are effective and have added value outside the population, health, and environment sectors, such as greater health and economic empowerment for women, greater buy-in and community support for health and environmental interventions, and increased time savings and cost savings for households and project implementers. In addition, the ability of PHE projects to reach young people can contribute to Kenya's accelerated economic growth by engaging with and investing in youth. The PHE approach has been shown to be more cost-effective than single-sector projects. Economists estimate that every dollar Kenya invests in voluntary family planning and reducing land degradation result in a $4 return. The cost-effectiveness of PHE interventions builds on these worthwhile investments. Slowing population growth, investing in health, and protecting our natural resources are critical to achieve Kenya's Vision 2030, the African Union's Vision 2063, and the Sustainable Development Goals.
County governments must, in their strategic plan, in their policy formulation, in their legislation, put a lot of resources to ensure that they are putting laws that can protect the environment. They have policies that will drive proper and positive environmental stewardship, and they invest enough resources in health sector to ensure that the rural population is healthy enough to be productive. That productivity will drive the county economy, which of course cumulatively will then drive the national economy.
PHE can play a critical role in improving the socio-economic development and quality of life of communities. We ask national and county leaders to affirm their commitment to PHE as a development strategy, review existing policies to enhance and promote the mainstreaming of PHE across sectors, and translate policies into action to effectively implement PHE. Kenya can seek guidance from the PHE strategy that was developed by the East African Community, a regional intergovernmental organization of 6 partner states, including Kenya. The national government should establish legislative frameworks to support PHE mainstreaming and build the capacity of government agencies to implement PHE approaches effectively. County governments should establish the institutional mechanisms to coordinate across sectors, integrate PHE into county development plans, increase financial commitments, and allocate resources for PHE. Civil society organizations working across different sectors should explore opportunities to collaborate on PHE efforts and support resource allocation at the national and county levels.
From the impact we have realized here, if we can actually extend it to other community, it can help a great deal. It can help most people to know how to manage for their farm or population, to know how to manage for their health, and actually conserve their environment.
It is time for Kenya to take the lead in sustainable development by addressing the collective effects of poor access to health services, limited income generating opportunities, depletion of natural resources, and the effects of climate change. Everyone has a role to play, but most critically, national and county leaders must demonstrate their commitment to the well-being of all Kenyans and the future of our country by investing in integrated PHE approaches. By recognizing the relationships between Kenya's people, their health, and the sustainable use of natural resources, and acting now, we can keep Kenya on the path to achieve its economic and development goals and improve the quality of life of millions of Kenyans while preserving our environment for future generations.